All right, so almost every county in the United States is a high transmission county. We've seen that coming, and we've been hovering above 99% for the past several weeks. Almost 99.5 of this is Omicron. The week ending January 19, the cases did drop a little bit. You can see on this little curve here. You may recall that these cases started in the Northeast and started blossoming shortly thereafter in the Midwest. Those areas are starting to come down in their case rate. We're not seeing that in the Pacific Northwest. CDC does project that cases will start to decline, but the shape of this decline may not be how it pans out. Even in South Africa, the case rates came up abruptly over a 3-week time period, and at 5 weeks after that peak, they were still cascading downward. So the downward slope may be slower than the upward slope. Getting the data has been very difficult from the CDC and the DOH. So I'll just present what I have, but it's getting a little frustrating for me. With regards to hospitalization data, the most recent data point is as of January 18, and did show a slight increase in the hospitalization rate, and yet the curve that they posted shows that the hospitalizations are starting to decline. So I can't explain that. Likewise, on the United States death rate, this little downward point here is January 18, and this point here is January 21, and yet they say that the 7-day moving average decreased 0.3%, and they don't mention any other reference date. So I don't know if they called this little decline down to the 18th as their deflection point, but if that's the case, then we only have data. They only report this up to the 18th. So a little frustrating trying to get a clear picture to present to all of you. The DOH did update their website, and yet they, again, only present some of this data as of January the 8th, which is very frustrating. For instance, on the Washington State case rate curve, they removed the incomplete data portion of the curve, and so this data only goes as far as January 8. Same thing with hospitalizations in Washington State, and with the Washington State death rate curve, it's as of December 20. And likewise for Walla Walla County, the most recent data point that they present is January 8. And we've been looking at this case rate ranking. This portion of the data is updated as of January 20. And you may recall Walla Walla was, 22nd, 25th out of 39 counties. Most of the top 18 counties were from the western side. We're now seeing more of the eastern side counties go up into the upper echelon of the case rate. And it's not that the western side is necessarily declining in cases. It's just that the eastern portion of the state is rising in cases. The most up-to-date data that we have for Walla Walla County is our case rate curve is 3519, and this is the raw case. 2200 is the raw case. We had about 500 new cases over the weekend, so we're getting about 200 per day. And there is some talk at DOH that cases are starting to plateau a little bit on the west side. I just can't get the data to confirm that, but I think we're still probably on the upswing, and hopefully in the next week to two, things will plateau and start to decline. As far as Walla Walla hospitalization data with the state, they only go up to January 8. This is the most recent data from Providence. There are 20 admissions. We are trying to work on this new nomenclature where we identify, first of all, we're trying to get them to identify if they're hospitalized with COVID or for COVID, and we have not been able to get that data yet. We're also trying to get information on whether or not they're unvaccinated and whether or not they're up to date on their vaccinations, meaning you received your primary series and it's been 6 months or less, or if you got the booster. So that'll help kind of give our county a little more information. So this is our current, the way we present the data. This will likely change as we get additional information. With regards to vaccines in Walla Walla last week, we had 5 clinics. There were 224 total vaccines, and the majority of these are booster doses, and only a small number of people are initiating vaccines. We talked about scaling up and down the clinics as needed. Based on this volume, we are looking at potentially scaling down even further, and also with FEMA funding potentially ending in at the end of March, we may have to continue to push our community partners to offer vaccines, and we may have to work on some other creative models to deliver vaccine in our county. With regards to testing, last time we presented, there were about 200 a day, so this increased even a little bit more. We're now up to about over 1,100 tests per week in Walla Walla. Our test positivity rate was presented on our website as being about 65%. I have not had a chance to talk to our EPI to see how accurate that data is, as usually the negative tests, there's always been a backlog of inputting the negative test data, which would change that value. That's been a chronic problem since the start of the pandemic. Also, there was an article in the paper about masks, and our original intention was not to be a distribution center here from Department of our Community Health, just because of staffing and manpower, but the library has received masks, Chamber of Commerce, and City Hall. So we'll work on some messaging on our social media posts so community members know where to get the masks. We're still probably on the upswing. I know tensions and stress levels are the highest they've been, and we just need to continue to work together and take care of ourselves and take care of each other.